preconditioning can decrease all complications after surgery. There was a beautiful study that was just published 2 months ago in the anesthesia literature. And what they looked at was every study that's ever been done using any facet of prehabilitation, whether it was just exercise, just nutrition, and looked at outcomes. And what they found was that any prehabilitation decreased at least one postoperative complication. And this study looked at 186 studies with over 15,000 patients. This was a huge study. I think the take home message from that should be really empowering to patients that even if you can do just one thing before surgery, you're probably going to improve some aspect of your surgical either recovery or decrease your chance of having some complication.
Hi, and welcome back to the Integrative Women's Health Podcast. I am here with Dr. Rebecca Knackstedt, and we are going to talk all about pre and post recovery and preparation for and recovery for surgeries that are not always considered when we think about pre-op and post-op care from a holistic, integrative, and rehab perspective. We often will think about that for orthopedic injuries, but in my career, I've struggled to even see us giving great pre-op and post-op care for C-sections, never mind in breast cancer or endometriosis. So Dr. Knackstedt has done a lot of work and is still a practicing surgeon at Duke in North Carolina on this idea of preparing her patients for better surgical outcomes by doing all this work before and after surgery. So, welcome.
Thank you so much for having me. I'm really looking forward to this discussion.
So, you've done a lot of research in this area or looked at a lot of research in this area. Tell me some of the most surprising things you've discovered when you looked at how preparing someone for surgery can really shift their outcomes short term and long term.
This all kind of goes back to my PhD, which was in vitamin D and had a heavy emphasis on nutrition, which I kind of just let go of during my residency training. During residency training, you don't have time to think about that. You're not really taking ownership of the patients. But when I started my own practice and really got to know my patients and saw anecdotally how lifestyle factors would impact surgical outcomes, I brought back my surgical or my nutrition training and started to implement really just nutrition advice for my patients. And I thought that that was going to be the game changer. I thought that just nutrition was the answer. And as I started to read more in the literature and look outside of even the plastic surgery literature, I found that it really was a holistic approach that was needed in order to optimize my patients. And that was part of the reason why I decided to be trained in functional medicine as well, because that really encourages you to have a holistic approach to patient care. So now I realize that it is nutrition, but it's also things like stress and anxiety management, sleep optimization, discussing what their social support is before and after surgery. That is really all critical for optimizing outcomes and ensuring a smooth recovery after surgery.
In an ideal world, what kind of team would a person have who is preparing for breast cancer surgery or dermatological surgeries, surgeries we maybe don't think of outside of sports related surgeries?
I think in an ideal world, first off, we'd have more time to prepare for surgery, which sometimes we do and sometimes we don't. So, in an ideal world, I think you'd have increased time to prepare for surgery, but then the team would be your surgeon and the healthcare providers that are going to be working on you during surgery. But then I think it would also be nutritionists and dietitians talking about optimal nutrition, psychologists or psychiatrists talking about stress and sleep and anxiety, social workers to discuss things like social support and financial burden of surgery, and probably more I'm not thinking of. But these are not part of a patient's routine healthcare providers before and after surgery, as you know.
Yeah, absolutely. So, what are some of the biggest needle movers in terms of nutrients, or is there a certain, amount of sleep quality or sleep hours, say for the 3 months prior to surgery? If we're talking about an elective surgery, obviously in cancer, we don't always have that much time, but even if we had 2 weeks.
One of the most important points that the literature gives us is that even 5 days of preparation before surgery can make a difference. That should be reassuring to patients that even if they don't have a lot of time, even doing simple things like optimizing nutrition, targeted supplementation can make a big difference even in 5 days. If you have longer to prepare, that's great, and we can work on more aspects of your recovery. One of the main points I believe is often misunderstood or misconstrued, especially in social media, is that when we talk about nutrition or targeted supplementation, it's not just bringing your lab values to a normal level. So, even if a patient is not protein deficient or vitamin D deficient, the studies indicate that you still benefit from protein supplementation, vitamin D supplementation, and that's because having surgery is such a stress on your body. It requires so much more than what you require on a day to day basis. So, even if you're in wonderful health and you have a great diet before surgery, studies indicate that you could still benefit from targeted supplementation.
And so specifically, that would be boosting your protein intake, boosting or optimizing your vitamin D from like 30-ish to more like 85 or
Yes.
90. Yeah.
Yes.
And any other specific nutrients?
The ones that have the most evidence are protein, because surgery is such a catabolic experience and requires so much protein to heal all of your wounds and mount your immune response and monitor inflammation. Another one is probiotics. Probiotics have shown in very well done studies to decrease pretty much every complication after surgery, including infectious complications. So, probiotics are one of the main ones I recommend.
Which strains? Which probiotics in particular?
Excellent question. And this is probably one of the main questions my patients ask me. It actually doesn't seem to matter.
Oh,
What
wow.
which is surprising,
Yeah.
but but also reassuring because it takes a little bit of stress off of when you're choosing a probiotic. But what the studies show is that the strain seem to matter less than the dose. So as long as you're getting about 10 billion CFUs a day, which is a high dose, that seems to be the level that is necessary to prevent postoperative complications.
So 10 million or 10 billion?
10 billion with a
Okay.
B.
Yeah.
Yes,
Okay.
which is a
Good.
big dose.
Yeah, I was like, "Wait." So 10 billion and even, there's lots of probiotics on the market that are a standard kind of combination of Bifidobacterium species and Lactobacillus species, so that might be a good place to start.
And most of the studies did use some combination of the bifidobacteria, the lactobacilli, and potentially some Saccharomyces or other various strains, but those were the most common ones in the meta analyses.
That's great. And so just having those three nutraceuticals on board could help reduce complications. What else anything else that you saw in the literature in terms of nutrients?
The other two that have the most literature to support them would be arginine and glutamine, which are conditionally essential amino acids, meaning that on a day to day basis, our body can produce enough to keep up with demands. But after times of stress, like surgery, your body simply can't produce enough. And the amino acids are the building blocks for protein. So, amino acids such as arginine and glutamine, they've been very well studied in the head and neck literature and have shown to decrease postoperative complications. The other one is somewhat surprisingly fish oils. Fish oils are omega 3 fatty acids, which are anti inflammatory, and patients have been told for years to stop taking them before surgery because of the risk of bleeding. This has thankfully been disproven in meta analyses showing that it does not increase the risk of surgical bleeding. So, that is another supplement that I recommend to my patients to modulate the inflammatory response after surgery.
Yeah, that's great. There was that really good research done in the military that showed up to like 9 grams of fish oil did not increase bleeding risk, even in like TBIs. So
Which is a
that's
very
good.
high dose.
Yeah, absolutely. Is there anything you do recommend people stop? Because that is one thing we tend to do for our endometriosis patients, is because the literature is fairly limited. Prior to surgery, we usually limit supplements or actually discontinue most supplements just because we don't have a lot of literature on the bleeding risks about a week to 2 weeks pre op. Anything that you particularly want your clients to stop?
That's a very good question and an important point. And even at an academic center, our anesthesiologist will typically tell patients to stop supplements for about 5 days before surgery. And to your point, we just don't have literature for most supplements. There are some supplements we know are unsafe to take before surgery. The ones that come to mind are vitamin E, which is known to increase bleeding risk, ginkgo, St. John's worts, and anti-inflammatories like Tylenol, ibuprofen could also thin the blood and lead to increased bleeding either in surgery or immediately thereafter.
And the other question I have about L-arginine is there is some data looking at L-arginine as to actually exacerbating mortality risks if people have cardiovascular events on while they're taking L-arginine. So I worry a little bit about that in terms of people that may or may not be like super heart healthy going into breast cancer surgery, given the risk to the heart of chemotherapy. Is there any way that you help to modulate or mitigate that risk, or are there just certain patients that you maybe wouldn't use L-arginine?
For all of my supplements, especially if I have them taking the supplements during chemotherapy, I always get buy in from the medical oncologist because the number one goal during chemotherapy is to shrink your cancer or get rid of the cancer completely. And I don't want to interfere with that. As always, I tell my patients to talk to their medical provider about supplements, but most healthcare providers don't know a lot about supplements because we're just not taught it. Most of my patients, if they're coming to me, if they've made it to my clinic, they've pretty much passed the medical clearance for needing reconstruction. I don't tend to see the sickest of the sick or the patients who aren't medically fit enough to have reconstruction. So it's really not a concern for most of my patients, but that's absolutely a concern for some unwell patients that it might not be good to take even for a short period of time.
Yeah, yeah. Well, and I think that goes back to the real benefit of having a team approach around pre-op care, mobility. Another thing that I think has been so valuable for my patients preparing for primarily endometriosis surgeries or excision surgeries or hysterectomies, even breast cancer, is vagus nerve toning. And you talked briefly about stress management. What are some of the things you do to mitigate anxiety? Because obviously, the more kind of nervous system regulation we have pre op, the smoother the surgical experience will be.
The average patient that comes into my clinic for their first discussion about breast reconstruction, where they've just been given a diagnosis of breast cancer and maybe they've even started their chemotherapy journey, they are in fight or flight mode. Their bodies are so stressed out. They're not sleeping as well, which worsens their stress and anxiety. And then they come to my clinic and I give them this buffet, list of options of reconstruction, which for some patients worsens their stress and anxiety. My number one go to is a referral to therapy and counseling. And we're lucky at an academic center that we have counselors and therapists that specialize in breast cancer care and can have those very specific conversations with breast cancer patients. I think the other thing to keep in mind is that there's very low risk endeavors that have been shown in the literature to decrease stress and anxiety. So things like yoga, meditation, acupuncture, guided breathing, easy things that patients can download an app on their phone for free and do those activities. I haven't actually ventured into the vagus nerve stimulation. We don't really have anyone here that offers that, but I think that that would be another really great option, especially for patients that are really struggling with stress and anxiety before and after surgery.
Yeah, and I think everything you mentioned is really valuable vagus nerve toning and nervous system regulation that doesn't necessarily need any additional devices. I mean, obviously they exist and sometimes they're valuable, but breath work often works really well, tai chi, yoga. So that's great. And have there been any studies done that essentially compared head to head, like people that had a similar surgery without pre-op care versus with even just 5 days of pre-op care?
The areas of surgery that have been most well studied in prehabilitation are hernia surgery. That's really where prehabilitation started, ENT or head and neck surgery, and cardiac rehabilitation. And those have routinely shown time and time again that just 5 days of prehabilitation, which is usually nutrition and maybe a little bit of exercise preconditioning, can decrease pretty much all complications after surgery. There was a beautiful study that was just published 2 months ago in the anesthesia literature. And what they looked at was every study that's ever been done using any facet of prehabilitation, whether it was just exercise, just nutrition, some combination thereof, and looked at outcomes. And what they found was that any prehabilitation decreased at least one postoperative complication, whether it was a wound healing issue, a length of stay in the hospital, readmission. And this study looked at 186 studies with over 15,000 patients. This was a huge study. I think the take home message from that should be really empowering to patients that even if you can do just one thing before surgery, you're probably going to improve some aspect of your surgical either recovery or decrease your chance of having some complication.
That's really amazing. Thank you for sharing that research. I think it's so encouraging for our community and our students and graduates because most of them, many of them have private practices that are working with people who, might be having either procedures or surgeries, whether it's for fertility or cancers. Really, there are quite a gamut of kind of women's surgeries that could be happening, so you could really build a whole practice around helping people prepare for and recover from surgery because I think that's just a huge gap in the healthcare system in general.
It's a huge gap, and it's a gap for a couple reasons. One is we're not taught nutrition in medical school. We're not taught lifestyle interventions in medical school. So most traditionally trained doctors don't have that background of knowledge to discuss with patients or even realize that those things will impact postoperative outcomes. The second thing is insurance. Insurance will not pay for most of these things. Insurance will pay for me to or pay for my patients to have some supplements after surgery, but not before surgery. There's just such a disconnect in what insurance will pay for and won't pay for, even though there's studies showing the cost effectiveness of doing it before surgery, which is a huge shame.
Yeah, absolutely. Because the cost of readmission, of infection, is obviously a lot more expensive than even 3 months of good health coaching. Yeah, exactly. So let's talk about after surgery. So, in your practice, what are some of the kinds of things that women who have breast reconstruction need to pay attention to post op? And what could they prepare? A lot of the things we do in endometriosis is have several weeks of casseroles and soups and bone broths and your supplements ready to go and your movement plan. How do they prepare post op?
I love that advice. And I liken preparing for surgery like preparing for a marathon. You can run a marathon without training, but it's going to be miserable. You can have surgery without doing any prep work. It just won't be as smooth or as complication free potentially if you would have invested a little bit before surgery. So I think that some of the things that patients can do to make their post operative recovery more smooth is exactly what you mentioned. Thinking about things as simple as meal plans, meal delivery, having meals prepared already, having your laundry caught up, things like that that you don't think about. But I will put you on activity restrictions for 6 weeks that don't allow you to do laundry, don't allow you to do grocery shopping or meal prep to the way that you're used to it. So I think that's the first thing. The second thing is that almost every patient after surgery struggles with sleep. There's so many things associated with surgery that negatively impact sleep: the general anesthesia, the pain, the narcotics, the sleeping restrictions, the discomfort from inflammation. So, having a sleep hygiene routine set before surgery, whether it's a certain time that you go to bed, lights out, blue light blocking glasses, noise reducing headphones, having that set before surgery is going to make your transition post surgery that much easier.
Yeah, and especially those first couple days in the hospital, it's even worse. So getting back to your own bed as soon as you can. And so I was going to ask, when you think about the wound care post-op, when we're talking about the actual skin health, Is there anything in particular that you found to be beneficial to that skin healing, particularly for women who are in estrogen restricted state because either they're put into a menopausal state because of their cancer, or that's just how old they are and they can't tolerate hormones, or their hormones are at too low level to really keep the skin very nourished?
As plastic surgeons, we think a lot about scars. We think a lot about incisions and making them beautiful. I think there's a couple things, both that I can do as a surgeon and that the patient can do to help make that scar as beautiful as possible. So, the first is what I do in surgery, and it's just adhering to good surgical principles, trying to make things not under tension. And then what a patient can do after surgery is the most important thing, I think, is adhering to postoperative activity restrictions, which is so hard for patients that want to get back to baseline. They feel good, they want to do the activities that they feel like doing. But if you move that incision area too much too early, it can lead to issues wound healing and widened scars. What the literature shows is that there's really only a couple things that you can do to help scars heal well. One is silicone sheeting or silicone gels, which need to be worn about 24 hours a day. Not always very well tolerated or convenient, depending on where the scar is located on your body. The second is sunscreen. Sunscreen for the first year after surgery. If you don't use sunscreen, even under a light t shirt, you can get a really darkening of the scar, which really doesn't fade. And interestingly, onion extract. Onion extract has shown to be one of the ointments that seems to help with scar healing. I also have my patients do scar massage. As soon as we take off their post operative dressing at about 3 weeks after surgery, we start doing aggressive scar massage once a day, and we do that for a full year.
That's fantastic. Yeah, I think physical therapists and occupational therapists are great kind of referral partners for scar care. Pro tip on the silicone sheets, you can actually get them now on Amazon. There's one company called Sika Care that I've used for 25 years now that you can reuse that over and over, so it's a lot less expensive. And it's funny you say about onion. So as a kid, I was a gymnast, and you get tears on your hands from bars over and over. And we used to sleep at night with half an onion and socks over our hands. So
And it was actually evidence based. You just didn't even know it.
I know, who know? So when you're talking about post-op recovery, anything else that you want your clients to start doing when it comes to return to activities, when it comes to lowering that pneumonia risk? Any like breath work patterns or pacing of exercise?
The number one thing you can do is walk after surgery. Typically, I tell my patients to not elevate their heart rate for a few to several weeks after surgery, so no rigorous activity, but at least getting up and walking once an hour, taking those deep breaths. When they're in the hospital, that have an incentive spirometer, which they'll actually go home with, and I encourage them to do that at least several times an hour. But just getting up and moving is the number one thing you can do to really prevent pneumonia and encourage that deep breathing. I also have a very low threshold to refer my patients to physical therapy. I love referring my patients to physical therapy. I think it makes a world of a difference. So when I lift my activity restrictions, whether it's 2, 4, or 6 weeks after surgery, if they don't almost immediately bounce back to baseline, I recommend a physical therapy, even one visit to get some activities that they could do at home. And I have found that that makes a world of a difference for patients.
That's wonderful. So, in an ideal scenario, you have anywhere from 5 days to 3 months to optimize sleep and anxiety and nutrition and nutrient excessive sufficiency, not just baseline sufficiency. And then ideally a calm, clear surgery, no drama there. And then pretty quickly after, people are getting up and moving around, but not pushing. How do you talk to your clients? Women are usually doing a lot. And I agree with you that the hardest thing is actually to slow down the pace enough to have a more optimal recovery. Are there any kind of words of wisdom that seem to resonate with your clients about that pace of recovery?
It is hard. And most of my patients are women. But you're right. They are sometimes the primary caregiver of their children, and they want to lift their child up after surgery, and they can't for a few weeks, which is really hard on both the mom, the child, and just that interaction. I think the main thing is I have very long discussions with my patients about what is the right surgery for them at this point in their lives. So we can do some fairly non invasive, not big surgeries for breast reconstruction, or we can do really, really big surgeries that have a much longer recovery and are much more invasive. And for some of my patients who are young women with young kids and a busy career, it's just not the right point now for them to have that bigger surgery. So, at least for breast reconstruction, I talked to them about this is a lifetime journey. And even though you might want this bigger surgery for the longer recovery, it just might not be right now. So I think just an open line of discussion with your provider. And I love when I ask my patients what their hobbies are, and I ask them who lives with them at home, because that gives an insight as to what's important to them and what they want to get back to as soon as possible. And I allow that to help guide our decision making.
Excellent. I love that. So, is there anything else you want to share about this passion of yours around optimizing surgical outcomes?
I would say that the only other thing that we haven't talked about is just lean muscle mass. And this is one of those things that I came to late in my practice as to recognizing the importance of it. And it was through patient discussions. I always knew that surgery was a catabolic state and that it required protein for healing. So when I thought about optimizing a patient for surgery, I would just tell them increase your muscle. So resistance training, aerobic activities, increase protein intake. But what patients told me after surgery was that they needed more targeted muscle development for preoperatively to optimize their functionality postoperatively, which I never really considered. So if I'm doing a breast reconstruction on someone and I tell them be careful with your arm activities for the first 4 to 6 weeks, they do need to strengthen their arms, but what they really need to work on is their core and their leg muscles, because that's how they're going to be transferring. That's how they're going to be getting out of bed. So that was a really eye opening moment for me. And so now when I talk to patients about preparing for surgery, it's the general idea of nutrition and supplementation and exercise, but also specific for that surgery that they're having, what they should particularly focus on.
Right. And certainly areas of compensation if they're not going to be able to use their arms for a while and they may lose that muscle mass to some extent.
Exactly. Mhm.
So, how are you going to get around that? And this is where I think OT can also be really helpful. What other tools can they use? What other strategies, whether it's tables or reachers or, lots of things, in addition to if we have the time prior to surgery, really building up physical strength because yeah, you're going to lose some of it. I mean, the data about bed rest somewhat applies to people who are just have mitigated activity in general.
Yeah, there's studies in healthy adults showing that just a few days of bed rest can decrease your lean muscle mass by about 4%. And that's without the catabolism of surgery. So that lean muscle mass is dipped into very quickly and very rapidly after surgery.
Yeah, absolutely. Well, if people want, are in this position themselves where they either need reconstructive surgery or they have friends or family members, where can people find you and learn more about your surgical practice?
Yeah, so I started an Instagram channel to really just spread the word to patients everywhere and healthcare providers. It's at surgical underscore recovery. That's also on TikTok and YouTube with the same handle. But I love hearing what patients want to learn about. So feel free to send me a message if there's a topic that I haven't addressed. But this is really just an exciting time to be in this area because there are so many unanswered questions. And we're really just starting to scratch the surface of understanding how best to prepare patients for surgery.
Excellent. Well, thank you so much for your time. This has been really valuable to take a moment to see while the research is limited, there is some, and we need to start there.
Yes, thank you so much for having me.
Thank you.